We're looking forward to discussing ACA changes and Medicaid expansion, what blood cancer patients need to know, and how to stay prepared. We chose today's topic because the landscape of our insurance options is changing, and we know it's important to stay informed about how those changes might affect you. I'm going to start by introducing our speaker for today's event, Diahanna Vallentine, and then we'll jump right in. Diahanna is, of course, the Financial Advocacy Program Manager for HealthTree, specializing in financial help for blood cancer patients. As a professional finance advisor and former caregiver of her husband, who was diagnosed with multiple myeloma, Diahanna perfectly understands the financial issues facing blood cancer patients. And with that, I'll turn the time over to you, Diahanna.
Thank you, Cynthia, and Happy New Year to everyone. I hope everybody are staying safe and had a great time and relaxed and ready for the new year. So we're going to go through some important topics: Affordable Care Act, what's happening with Medicare, Medicaid, and how those things work together. We're going to touch a little bit on TRICARE. So I want to urge everyone to be informed, to stay informed with what's going on our landscape, because there are going to be changes. There's a lot of loud rumblings going on as to what's happening with Medicaid. They may be increasing the income requirements. There may be work requirements. We're going to go through that a little bit further on down the road. But you need to be updated, stay in tune with what's going on. So we're going to go through what is the Affordable Care Act, which is also known as Obamacare, where you get to the marketplace or through your exchange through your state, and what is new in the political landscape regarding the Affordable Care Act that we know now, or things that are on the horizon and may change. Who can enroll in the Affordable Care Act? There's a lot of misnomers out there about who can enroll in the Affordable Care Act or Obamacare. How and when to enroll. In fact, ACA enrollment is going on now. It will go on through the 15th of this month. So please go out there and look at options that may be available to you. And I want to stress, anyone can enroll in the ACA or Obamacare or through your marketplace. You can be enrolled through your or have options through your employer. It may be kind of late for that because you may already be enrolled in your employer, but anyone is eligible. It may be less expensive through ACA. There are a lot of credits or incentives for people to enroll at ACA where it may not cost as much for the same type of coverage. So we're going to cover that. What does a future look for ACA, and how can you prepare for changes? Because you need to be aware of what's going on. What is the Medicaid expansion? Not all states do not have Medicaid expansion. What does that mean to you? And what kind of changes are coming down the pike with Medicaid? What you need to do to qualify and to stay on Medicaid? How does Medicaid compare in coverage to private health plans? And what does the future look like for Medicaid, and what you can do now to prepare? We're going to go through these things. Hopefully, please take notes. There's going to be some links in here for you to go to should you need help. But let's get started.
All right. And Diana, I didn't want to interrupt you, but I'm not seeing your video. Do you want to see if you need to make an adjustment there? Perfect. We see you now. I'll go ahead and move on. Thank you.
Thank you. So what is the Affordable Care Act, or Obamacare? It was signed into law in 2010 to make healthcare insurance more affordable and accessible to more people. In fact, there are millions and millions of people that were able to get insurance that had not been able to get insurance prior. It also had a goal to expand Medicaid. You hear about Medicaid expansion in some states to make affordable insurance available and to support innovative medical care. The Affordable Care Act makes insurance more affordable to more Americans by providing subsidies to reduce or offset the cost of premiums. Now, that is one of the things they're going to be possibly changing. Those offsets and subsidies may not be there to help as many people, so the cost of those premiums may go up, which means people may find that even the ACA may become too costly for them to afford. Anyone, even those who have insurance through employers, can apply for ACA coverage. Some may even find it less expensive. This may change in the future with the new legislation taking up the cost to change or replace the ACA. Again, there have been, since ACA came out, there was plans to repeal or replace, and those arguments are still going forward. There may be some changes to the actual plans as they currently stand. Next slide. So, so who can enroll? Again, anyone. However, if your income drops below a certain amount, you will generally qualify for Medicaid. In some states, where if you call and say, I want to go on the exchange marketplace, which is the ACA, they will ask you about your income. And if your income falls below those thresholds for ACA, you may get subsidies or you may automatically be enrolled in a Medicaid program. So in order to be eligible for the Affordable Care Act or Obamacare, you must reside in the United States. You must be a United States citizen or a national or be lawfully present in the United States. For those who are legal immigrants, as of December 16th of 2024, if you are a DACA recipient or have certain eligible immigration status, you're now eligible to enroll in marketplace coverage, regardless of the state you live in. In the event there are changes in this ruling, you will be notified and Marketplace will send you a notice and they'll give you due time, usually 30 to 60 days, to make changes if there are changes available for you. There will be a preliminary court decision and final decisions could affect your eligibility for coverage. And if you want to go more into that, you should be able to go into Medicaid or Medicare.gov. It'll explain those things in depth, especially when there's going to be changes coming out. I will tell you, I'm keeping up with all of this. If there are going to be changes, or if there's big changes going on, I will be notifying you either through a webinar, through on our Financial Connect pages, or in a article. So you need to keep up with these things, sign up for our webinars so that you can be aware of what's going on. There's going to be a lot of changes this year. This is a very big year for what's going to be happening in the insurance arena. Next slide. So young adults, those are people who are 26 years old, those who are in college can stay on your family's insurance plans until age 26. So that's going to continue. Hopefully that will continue. Again, things are up in the air. Next slide. So you can go to www.healthcare.gov. This is a link that everybody should have in their book where they keep all their important information, because it'll help you keep up with what's going on, help you understand about your own insurance or options you may have, and including if you need to do appeals for anything, that's a great place to start. This link will also tell you more about immigration status and eligibility. As those things come down the pike and changes will be there. You will also find a list of documents needed to apply for marketplace plans. A lot of those things can be done over the phone. You'll talk to a representative who represent the marketplace plans. They can get the information. They may request additional information, proof of income, but it goes relatively smoothly and is usually quick from the time you put in an application to your acceptance. There are patient protections under the Affordable Care Act when you're insured through the marketplace. That's Obamacare. Insurers cannot refuse you coverage based on your gender or pre-existing conditions. That stays in effect. There are no lifeline limits on coverage for essential benefits. For instance, it used to be $1 million lifetime coverage. And if you have a illness such as cancer, that you can run through those things relatively quickly, but there are no lifetime limits on coverage for essential benefits. And I don't hear any rumblings about this changing. Hopefully it will not change. Next slide. The cost of your plan that you choose will depend on where you live, again, your income and the size of your household, because that affects your poverty levels, your poverty lines, how many people need to live off a certain income. So those things will be looked at together. The associated costs would include your co-payments, and this is for your cost of your plan, would include your co-payments, your co-insurance, deductibles, your monthly premium, and your out-of-pocket maximums. You can go again to www.healthcare.gov, and you'll be able to do comparison shopping between plans based on the plans that you're eligible for in your state and in your city. Next slide. So again, where can you go to apply for the marketplace plan? I gave you that site again, and you can also call your state health insurance program, and they can get you the information and steer you to where you need to go to get comparison plans and to put in an application. You can apply by phone. You can apply in person with an in-person assistant who is trained and certified by the marketplace to provide free help. They are invaluable. They are great to answer the questions that are relevant to your situation. Talk about what kind of verification you need for income, how long it will take, who is in, if it's a network, not network, all these things. They can answer those application questions for you. So those navigators are certified application counselors. They have been trained. Contact the marketplace call center to compare plans, finish an application, or enroll in a plan. They are available every day with the exception of certain holidays that are available in other languages. Another thing you might want to be aware of, if you are putting an application and you anticipate your income is changing, let them know that, especially if your income is going down, because you might still be able to apply and get some of the subsidies toward your premiums. You can also work with an agent or broker. I would, just like you would for other insurance programs, I would caution you, they may not have all of the information or all of the plans available. These are trained professionals certified to sell health plans in the state they're licensed. These professionals are generally paid by the insurance companies when people they help enroll in the plan they sell. Again, when people they help enroll in a plan that they sell, they may not have all the plans available to them, or they don't sell all the plans, which means you may be missing out on opportunities if you're not working with a specific certified marketplace application counselor who would have all the plans available to you, so you can do some really good apple to apple comparisons. Next slide. So what does the near future look like for ACA? It's up in the air. Because there's a lot of concern for how the Affordable Care Act may change under the new administration. You've heard it, they're appeal or replace. Nothing yet has been set in stone, but there will be a lot of talk around this over the next year, at least the next year. Some of the possible actions include some or all the subsidies may go away, which means there'll be people off the rolls and may have a harder time finding insurance that is affordable to them. There are some things that are set to expire at the end of 2025, even if the new administration doesn't do anything. So we need to keep an eye on this and make sure that if it's near the end of 2025, if you have other options, such as enrolling in an employer plan or a spouse employer plan, then you'll have the option to do that before it's too late. Keep an eye out for this because the subsidies are not, if the subsidies are not expanded, premiums can increase significantly, making healthcare unaffordable for many people. This will be around the time of open enrollment for your employers. Keep this in mind when reviewing your needs and ability to pay for insurance. And also keep in mind how your income can affect either being on Affordable Care Act, if it continues as it is, or getting into Medicaid. Those things are going to be very, very crucial for you to understand and to be proactive in managing your health insurance. Next slide. So what is Medicaid? Medicaid is a joint federal and state funded program that provides adults and children with limited income and resources health insurance and can also provide financial assistance to other programs based on income, such as Medicaid can help you pay for Medicare Part D premiums through the extra Medicare savings program or extra help. It is possible to be covered by Medicaid as well as Medicare. Medicaid is managed by states. So it's funded in several different ways through federal funding or through taxes. But the states can determine what their criteria is for you to apply for and to qualify for the Medicaid in that state. The next slide. So there are 4 types of Medicaid. A lot of people are kind of surprised to hear that. There are 4 types of Medicaid, and they're designed to cover different groups of people depending on the need and the situation. There's the traditional Medicaid. This is one most people are very familiar with. This is the original program that provides coverage for doctor appointments, hospital visits, and long-term care. Medicaid is income driven. Okay. Then there's a Children's Health Insurance Program, otherwise known as CHIP. This provides coverage to children and families who have incomes too high for Medicaid, but too low for private coverage. So you're stuck in a conundrum there, too low for private coverage, which means your income, you can't afford the private coverage, and it may be too high for Medicaid, but then there's a CHIP program that can give children and families covered. Then there is a Medicaid expansion. This is not available in all states because all states did not choose to participate in the Medicaid expansion. The state has the option to participate or not. This Medicaid program is a result of the Affordable Care Act. It extended coverage to more low-income adults. So what it did is the regular Medicaid program, the expansion created other opportunities for people who are low income or not quite as low as normal or traditional Medicaid to be able to participate and get some kind of coverage. Medicare savings programs. It's another one of the types of Medicaid. This program provides to individuals who qualify for both Medicaid and Medicare financial assistance to pay for Medicare out-of-pocket costs, such as your Part B premiums for your Medicare Part B. Next slide. So again, each state has their own rules and qualifications for these programs, and the states can get on or get off or change the qualifications within their program. Therefore, there is substantial variation among states in factors such as Medicaid eligibility, covered benefits, and provider payment rates. So be aware of what's available in your state, not only what's changing on the federal level, but what's also changing on the state level, so you can decide whether Medicaid is an option for you or if there are other programs that may be available to you. Next slide. So again, who qualifies for Medicaid? Again, I told you this was a income-driven program. Medicaid is driven or income-driven funded product through both the federal government as well as the state. The health care provided through Medicaid is not always free. Medicaid is based on your income and family size, and the eligibility rules, again, differ among the states. However, in all states, Medicaid gives health coverage to some individuals and families, including children, parents, people who are pregnant, elderly people with certain incomes, and people with disabilities. Some states have expanded Medicaid, which will provide a broader range of covered people. Again, that's expanded Medicaid. There are 7 or so states that have not signed up for expanded Medicaid. Next slide. So last year, many fell off the Medicaid rolls, and I know you heard there was many people were signed up into Medicaid, and ACA caught a lot of those people so they could be enrolled based on their income. The problem last year, and there was COVID allowed people to stay on the Medicaid without having to go in and update information, whether it's address, income, all of that stuff. It was not required. Last year, it was. A lot of people who, whether they didn't get the notification, they're no longer in the same place, did not go in and re-enroll. Millions of people fell off the Medicaid roll. And that means there's millions of people now who are not covered, who were covered prior to last year. So for those of you who are concerned or know someone who was on Medicaid and now they're not on Medicaid, they don't know why, they need to call Medicaid and see if they can get re-enrolled. The new administration, based on what their rumblings that are going on now, they're saying they're going to put work requirements into place for Medicaid recipients. One of the concerns is how is this going to affect disabled people? That is a concern. Also, eligibility requirements may become more stringent. I will broadcast this information again as it comes through the comes through the webinars article as well as our Financial Connect page. So you can be updated onto what's going on so you can know what you need to do and what you need to prepare for to keep your insurance in place. Next slide. So how do you apply for Medicaid in your state? And there are 2 ways. You can go directly through your state at www.medicaid.gov or through the Health Insurance Marketplace. You can visit healthcare.gov to create a marketplace account and complete an application or call 1-800-318-2596. When you get to the part of the application, ask if you'd like to see if you can get help paying for coverage. Always select yes. It's not going to change your application status or your eligibility at all. It's just going to allow them to look further to see if you can get help paying for some of your coverage, such as your Medicare Part B premium. Also, if the information you supplied on the application shows that someone else in the household might qualify for Medicaid, the marketplace will forward your application to your state for final eligibility decision, which means they might see if anybody else can qualify, like you may have a child or you may have a disabled person. There may be additional coverage for household members. Next slide. So there is a difference between Medicare and Medicaid. A lot of people are not aware of what some of those differences are. I'm going to go through this. One of the big things we're going to talk about is long-term care. A lot of people think Medicare pays for long-term care. They care for long-term inpatient care up to 100 days, but there's costs associated with this. But we want to go through this. So Medicare, as you know, is a federally funded program that provides health insurance for persons 65 years old or older, and for those people who are under the age of 65 that have certain qualifying disabilities or conditions. The federal agency called the Centers for Medicare and Medicaid Services run Medicare. Because Medicare is federally funded, Medicare sets the standards for costs and coverage. When you have a Medicare plan, the coverage will be the same no matter what state you live in. Federal law requires, and this is called the Medicare Part A and Part B. This is not going into your Medicare supplement plans, such as Medicare Advantage or your Medicare supplement plans or Medigap. Federal law requires states to provide certain mandatory benefits and allows states the choice of covering other optional benefits under Medicaid. Here are the mandatory benefits under Medicaid that must be covered. Next slide. So Medicaid must cover inpatient and outpatient hospital services, physician services, lab and x-ray services, family planning services, early and periodic screening, diagnostic and treatment for children, nursing and facility services for eligible adults. States may choose to offer additional benefits within the broader federal guidelines, as well as with expanded Medicaid. States may choose to offer additional benefits under that. Next slide. So Medicare bills are paid from two trust funds held by the U.S. Treasury. Different sources, including payroll taxes and funds that Congress authorizes, fund the trust funds that pay out for your Medicare. Medicare enrollees pay part of the cost through things like Medicare plan monthly premiums for medical and drug coverage, deductibles, and coinsurance. So here's something that's important to note. Since Congress authorizes the trust fund sources, they can either increase funding through payroll taxes, or they can authorize increases in premiums, coinsurance, and they can reduce or eliminate coverage. Everyone needs to be cognizant of what Congress may do because it will affect your cost and coverage for Medicare. And there are loud rumblings that changes are on the horizon. So keep this in mind, not only for Medicare, but for Medicaid as well. Next slide. So Medicaid is, again, a joint federal state program that helps cover medical costs for some people with limited income and resources. And again, it's income driven. All state Medicaid programs must follow general rules that the federal government mandates, but each state runs its own program. This means that the eligibility rules may vary from state to state that I mentioned before. Medicaid offers some benefits that Medicare does not offer, such as nursing home care. You may be aware or may have family members or had friends or someone you know of who did not qualify for that had Medicare, and they were in nursing home or some facility where they needed to get care. They had a house, and sometimes they may have passed, or they no longer needed the nursing home care. They may have to sell that house in order to pay after a person's gone. And state may have to sell the house in order to pay back Medicaid for the cost of the nursing home. That is very, very common. So a recipient or the estate of that recipient of the Medicaid may have to repay the government for costs of care if applicable. Medicaid does not have to conform to the 100-day limit that Medicare covers. which means Medicare covers up to 100 days for nursing home care if you go from a hospital to a facility, but there may be additional costs associated with that per day after 60 or 90 days that you will have to pick up. They can cover beyond this 100-day limit, and it is covered from Medicaid. There may not be any co-insurance or co-costs or out-of-pocket costs to the recipient of that care. Next slide. Unlike Medicare. Next slide. Personal care. Medicaid pays for personal care services. This can include a nurse or qualified caregiver to help you with the activities of daily living while in your home. That could be for short-term or for long-term. They cover transportation for services to and from your medical services. Home and community-based services, a lot of people are not aware of. That includes home and community-based services, adult day healthcare, attended care, home delivered meals, specialized and non-specialized respite care. There are things that Medicaid will cover that Medicare will not. They will cover for dental, vision, and hearing services and prescription drugs. Medicaid can cover required prescribed prescriptions for you. And you don't have to worry about a lot of times paying any copays or deductibles or anything with your prescription drugs under the Medicaid. Next slide. You may have zero cost for covered service, but may have to pay a small copayment for some items or services. For more information about what Medicaid covers, go to www.medicaid.gov. Great site to go to if you anticipate your income is going to be dropping significantly. You're going to have to leave work. You may need additional coverage. You may be losing coverage through your employer, or you're going to need coverage and you're concerned about what you're going to do. Go to www.medicaid.gov or go to ACA to the marketplace plan to see if do you qualify for any of these other coverages. There's got to be something out there for everyone. Next slide. So there's dual coverage for TRICARE Medicaid. We rarely go over, and I apologize for that. I'm going to make corrections to talk about benefits that our veterans and their spouses and their survivors actually have under TRICARE. So veterans who are entitled to TRICARE through Veteran Services may be eligible for Medicaid and/or Medicare. Veterans cannot opt out of TRICARE enrollment to increase their chances of getting Medicaid or Medicare. So you have to have TRICARE. You cannot opt out and say, I want to get on Medicaid or Medicare. Instead, you have to have TRICARE, and then they're going to show which one is going to be primary or secondary on how things are going to be covered. TRICARE will be the first payer of medical bills, with Medicaid second. So if you have TRICARE and Medicaid, TRICARE is going to pay out first, and then Medicare is going to pay the remainder. For information regarding the coordination of these benefits, you can go to this link. Everyone will have access to this information, this webinar after the webinar is over. Next slide. So TRICARE and CHAMFA is a comprehensive healthcare program in which the Department of Veterans Affairs shares the cost of covered healthcare services and supplies for eligible beneficiaries, whether that be a spouse or a disabled adult child. TRICARE is a regionally managed healthcare program for active duty and retired members of the uniformed services, their families, and survivors. So if you're a retiree of the military or you are a spouse of a veteran who was killed in action, you are and will always be a TRICARE beneficiary and cannot choose between the two programs. I will tell you, I have spoken to veterans who did not know that their spouse was eligible for coverage under one of these military programs, and they are. So CHAMFA is creditable insurance and does not require additional coverage needs. So if you are a survivor, a veteran, a military spouse, retiree of a military spouse, you have coverage through CHAMFA. So you need to reach out to your Department of Veterans Affairs and find out what you need to do to get covered. Next slide. I can imagine that could probably save you some money, right? So when you have dual coverage for TRICARE and Medicare, Medicare will be the first payer. For more information, you can go to this link or you can call Medicare Services. For services covered by Medicare and TRICARE, again, Medicare pays first and TRICARE pays your remaining co-insurance for TRICARE covered services. For services that are covered by TRICARE but not Medicare, TRICARE pays first and Medicare will pay absolutely nothing. So you need to be aware of this. Find out what your cost is going to be, is it going to be covered, and find out if there's going to be any additional out of pocket that you're going to have to pay for. Next slide. So here's some important dates to remember. January 1st, it's going on now, through March 31st, is open enrollment for Medicare. And that's where you can change or drop your Medicare Advantage plan. If you drop it, that means you're going back to Medicare A and B, which is your traditional Medicare Advantage plan, but you will not have anything to cover that additional 20%. That is your responsibility. So if you decide to drop your Medicare Advantage plan, be aware of that. January 1st, the same time period through March 31st, is the general enrollment for Medicare. You can enroll in Part A and or Part B if you missed your initial enrollment period. If you are employed and you have insurance through your employer, you may not have to get a Medicare Part B coverage until after you leave that employment. Now, November 1st through January 15th, you only have 7 more days for this, 8 more days. Through the ACA or Obamacare, through the marketplace, you can still enroll in a marketplace plan. So if you don't have insurance or you're not sure what your insurance is going to go to, get online and find out if you qualify, if you have subsidies available to help you cover the cost of your Affordable Care or your Obamacare plan, and do some comparisons and check. It's very important for you to do that before that time period expires. The next slide. So in summary, I know there's a lot, and there's a lot that's going to be going on this year. So this may be an unprecedented time in healthcare with the new administration. Changes are sure to come. And some of those things you may thought you were covered for, like we were covered for before, like immunizations, through telehealth, through subsidies, a lot of these things may be changing. So you need to keep up with possible changes as they may affect your coverage and the cost of your coverage. I will put alerts in the Financial Connect site when and if there are any. My webinars are always relevant and timely. I encourage everyone to sign up for them monthly. Also, review the Connect pages for more financial relevant information. Please reach out to one of our financial advocacy leads or our financial coaches. Should you have any questions, you can go through the HealthTree Coach website in order to do that. If you are listening to this webinar and you have not signed up for HealthTree, I encourage you to do it. There's so much information there. There's information that's going to help every single one of you, whether it's understanding your disease, understanding the cost of your disease, where to get help, where to talk to someone about similar things that are happening with you, where to find out, where to find specialists, where to find out about your disease, get information about clinical trials. There is so much on the HealthTree website that I encourage everyone to sign up for that. No matter what your cancer is, please sign up. Next month, we're going to be doing a Q&A. The first Tuesday, we're going to be doing a Q&A, and it's about anything that you have questions regarding anything financial. So please sign up for that. That's going to be the first Tuesday of February. Please sign up for that. Thank you all for joining me. I really appreciate you being here.
Okay, thank you so much, Diana. Sounds like there are some very important changes coming our way. And so I appreciate you sharing all this information with our community. We'll now open it up for questions. So we've got this time especially set aside for you to ask those questions. As Diana mentioned, we do also have our Q&A coming up. But since these topics are, on our mind currently, let's get as many questions as we can. You can go ahead and type those in the Q&A and just jump right in. So we've got our first question from Dawn. It says, I am currently working and will turn 65 in 4 months. I will be on TRICARE for life. Anything I need to know to prepare?
Well, if you have TRICARE for life, you may also qualify for Medicare benefits. So find out, you can do 3 months before, the month of, and months several months after to sign up for your Medicare benefits should you need some. I would suggest you sign up for Medicare. Because you do qualify for Medicare and you can be on TRICARE as well. And when I mentioned in here, one will pay first and the other will pay second, but you're going to need to sign up for Medicare. You can go online to Medicare.gov and speak to someone and talk about what is eligible, what Medicare plans are eligible in your area, associated cost and all those things. But yeah, start looking into it now.
Okay, thank you. Tom says, I read that previously cancer patients paid for their meds, which could be up to 100,000 per year. Biden signed a change that cancer drugs are covered. Is that true?
Okay. I tried to address this a lot last year because a lot of these things were coming up. In Medicare, there is a max out of pocket. I think that's what you're referring to of $2,000. But that $2,000 max out of pocket only applies to medications that are covered under your plan, all that are formulary in your plan. All drugs are not covered under every plan, and they may be covered differently. So you need to look at your plan and find out if those expensive blood cancer drugs are covered under your plan. If you have a Medicare Advantage plan and it does not cover a particular drug, expensive drug, it is not on formulary, it does not apply, that $2,000 max does not apply, and you will be paying for that full cost out of pocket. I know that's scary. I've been trying to alert people to that. But no, it's not all drugs. It's not all plans. You need to look at what plans are available to you in your state, in your city, in your zip code, and make sure that you have your in-network providers will remain the same because they drop off or change all the time, as well as medications, the cost on those tiers. If they're not formulary and not covered on your plan, you are responsible for the full cost of that drug.
Yeah, I know there's a lot of talk in the myeloma community about Revlimid specifically that we've, of course, covered quite a bit. So very important information to make sure that your plan covers those medications. So thank you.
Yes, and it's actually over $100,000 a year. It's more like $26,000 a month.
Wow. Wow. Tom had a follow-up to that, and he's wondering if this was a law enacted by Congress or an executive action that could be easily reversed.
Well, can it be easily reversed? It can be reversed, but it takes a while, just like any other thing they're arguing in Congress or arguing about. It's Congress usually has to approve these changes. But you have arguing going on both sides, and the makeup of Congress now, and I'm telling you, this unprecedented is it's like, I don't know. I don't know. I'm afraid, I'm concerned, very, very concerned. Because we just don't know. I'm sorry, I wish I could answer it better. Things can change, but it usually takes arguing back and forth if things change or if they change at all. And if they can't change, you have to be notified. You're going to have to be notified. Usually you get a 60 day notification and the options you have to make those changes if there are any.
Right.
I'm sorry, I know it's a very stressful time for everyone.
You're good. And this is just for my own curiosity with those notifications. Are those generally like by regular mail, phone call, or how does
Yeah,
that come
they're
about?
generally sent out by your healthcare provider, your insurance provider. They will send notifications out.
Okay,
Again,
perfect.
any big things are coming, anything's coming, I'm gonna put in our Financial Connect webpage, I'm gonna put out there so people be aware of what's going on.
Okay, thank you. Got another question from Rebecca. She said 2024 Medicaid coverage ends 3/31/25, if you know your 2025 income is going to put you above the 2025 Medicaid eligibility, should you switch to the marketplace now or wait until March?
I would wait until March to change it because you still have the coverage through that period of time. Now, I don't know if states are going to change any of their qualifications for the Medicaid expansion, if you're even in a Medicaid expanded state. If your income is going to go up, you might want to start looking at ACA just to get an idea of comparisons. If your income is going to drop, then you could possibly stay on Medicaid. But I would start looking around, get an idea of what's out there and what kind of coverage it would be if you still have subsidies. Now, the subsidies are set to expire at the end of the year. So if you could get into ACA after March and maybe still participate in those subsidies, depending on what your income's going to be, it's to your advantage. Of course, we don't know until the end of the year what's going to happen.
Yeah,
Possibly
absolutely.
sooner.
Yeah. We've got another question that says, I changed my Medigap plan due to cost. I had to mail the application in. I received a letter stating the application was not received in time. I used mail tracking and I can see that it was delivered on December 7th. What can I do?
That's for Medigap.
For Medigap, yeah.
Okay, you can contact your state health insurance program and ask them what you can do if you have verification of that. I would contact them because you don't want to be knocked off of something and not have to, it cannot, and have to qualify through underwriting or be pushed off because of underwriting or not be able to participate in it again. And some states, you're always going to have a Medigap plan eligible to you where you can enroll throughout the year. Very few states allow that, but I would check into that again. I would call I would call the state health insurance program. Every state has them and they can help direct you with that problem.
Perfect, thank you. We've got another question that asks, is cancer of any type considered a disability?
No.
Okay.
And whenever you qualify for disability, and there are people with cancer who are thrown, even with myeloma, who have applied for disability and have been thrown off or said they've been denied. It's not unusual for people who are extremely, like, to anybody would be obvious. You're in a wheelchair or you're in a bed, you can't get up and work, you sleep all the time because of your medications, your illness, and they could be denied coverage. Okay, so not every cancer is covered as a disability, and it depends on where you are in the treatment process, what your doctor says about your actual health condition.
Perfect. And we've got somebody asking about the Revlimid coverage on Medicare. Can you just go over that briefly with some of the things that we saw?
Sure. Revlimid, a lot of the Medicare Advantage plans are not covering Revlimid the way they used to. Now, they may be covering the generic lenalidomide. They may be covering the generic of that. If you have a Medicare Advantage plan and you've been taking Revlimid, you can ask your doctor to put you on the generic. Now, there was a problem, and there may still be a problem in some areas of lenalidomide for the shortages, in which case you may talk to your doctor. And it's another thing I've been telling people about. If it's medically necessary, if you're taking Revlimid, it's medically necessary to take that Revlimid, your doctor can put in an exception to your insurance company. He would have to write the letter and say, this is medically necessary. We need to have this covered. So there are exceptions. Again, check your Medicare plan, talk to your doctor, and do this ahead of time. If you looked at your Medicare plan, now it's too late to change your Medicare Advantage, and it's too late to change that, then look at your plan, call your provider, your health insurance provider, and file an appeal, have your doctor write the letter of medically necessary. That's important, it has to say medically necessary, And you might say if it's one of those things you need to have immediate, have them make a decision because the decision may have to turn around within a few days.
Yeah, thank you. Um, I was surprised with the nursing home coverage that you mentioned with Medicaid, that sometimes the Medicaid will require repayment. Is that state by state, or is that, how does that usually
That's
handle?
it's state by state, but generally that's a common theme. If you are Medicaid eligible, and let's say, like for instance, my grandmother went into a nursing home and she had a home. And instead, in her will, she says was leaving us to family members, right?
Mhm.
But then because she was in a nursing home for almost a year and a half, then the nursing home says, well, what kind of assets, a lot of times you have to qualify for these things. What kind of assets do you have? And they may go and say, we have to collect that from, you got to sell the house. And so there may be in an estate plan where family members may be anticipating this part being heirs to something and realize because Medicaid was taking care of something, then they have to sell the home to repay back Medicaid. That is very often the case. That's why I tell people to talk to a financial advisor. If you anticipate possibly going into a nursing home, possibly, we don't know, right? Um, you or your spouse, then you need to work. There are things that estate, especially elder care attorneys, can work with your financial advisor to minimize the impact of the cost of these things so that you can have things titled or done correctly within a specified period of time to make sure you minimize taxes, minimize going back and having things taken or reducing your estate. There are a lot of things that can be done and people just don't know or just don't do it.
Yeah, that was a surprising thing for me. And I like that you mentioned, of course, how to legally protect the family from those collections. So thank you.
Right.
We've got a question that says, I am smoldering multiple myeloma. Does ACA consider smoldering a pre-existing condition?
It is considered smoldering a diagnosed illness, so it's pre-existing. But pre-existing does not stand in place in the ACA. That's one of the things the ACA did. It says they threw out pre-existing. You can get qualified even if you have whatever.
Okay, perfect. Um, it looks like that is the end of the questions. We've got a lot of thank yous. Thank you, of course, Diana, for your time and for putting this information and great resources together. We really appreciate all that you're doing to keep ahead of all of the different things that are happening this year and just in general with the financial issues. So thank you so much.
You're welcome.
Perfect. And we will go ahead and close out today's session. Again, as Diana mentioned, we do have a Q&A coming up on February 4th. That will be at 1 p.m. Eastern. You can sign up once that link is available and then pre-submit some questions. So if something comes up later today that you think about, or even in the coming weeks, you're always able to pre-submit questions, and then we generally do get to live questions and answers as well. So we'll go ahead and on here. So, and as a reminder, as usual, we do have a quick 2 to 3 minute survey that we ask everybody to fill out if they're able to. The survey will appear automatically once you close out the Zoom. This just helps tailor our efforts towards the topics that are meaningful to you. So please take a moment to do that. We have several upcoming events during the month of January that I'd like to highlight. On Thursday, January 9th at 2 p.m. Eastern, our AML group will be talking about managing nutrition side effects as a fresh start for 2025. January 14th at 3 p.m. Eastern, our myeloma patients will be talking about boosting our wellness, incorporating more fruits and veggies and plant-based foods into our diet. And then Thursday, January 23rd at 2 p.m. Eastern, our Black Myeloma Health will be hearing about maintaining oral health during cancer treatment and beyond, which is a hot topic for our multiple myeloma patients. So please sign up for those and many others through that link at the bottom of the slide. We'll also email this out to you so that you have access to that link in our follow-up email. Before we go, I wanted to highlight the Track My Disease feature in HealthTree Hub. Once you've connected your medical records, the Track My Disease feature provides you with the ability to gain one-of-a-kind access to your health information encompassing lab results, genetic profiles, and treatment histories, offering you invaluable insights into your own medical journey. On the screen, I have the link to sign up for HealthTree Hub, along with the email address of our amazing patient navigators who are available to help you create an account and connect your records. I'll also include this information about how to enroll in HealthTree Hub in our follow-up email, so be on the lookout for that as well. I'd like to again thank our sponsors for today's event. Those sponsors are Pfizer, Regeneron, Johnson & Johnson, GSK, Karyopharm, Bristol Myers Squibb, AbbVie, Sanofi, Adaptive, and Genentech. And finally, I want to say thank you all for helping build HealthTree's communities. I've added my email to this slide. Please don't hesitate to reach out if you have any questions about HealthTree or any of our programs. I appreciate all of you and hope you have a great rest of your day and hope to see you at another webinar soon.